Otherwise, Mr. Greenlee would have told us we couldn't do it at all. But I'd like to know those couple of questions. To get that out in the open, I think it's important that we understand how and why this was brought forward.
Sarah, do you want to answer that question, or do you want me to give a little more background first?
If you want to start with the background, and if there's further questions, I can add to it.
So I'll just briefly say the timeline that it was prepared, and what I can say about it, and then I guess I'll certainly let others who are involved speak about the timeline. That this is something we knew was going to be a discussion, and so this discussion was going around the state and various organizations, the nursing home groups, corp council groups. So corp council, I think sent the first email about maybe we should have a conversation about this, and that was before Sarah was in an interim role. So there were discussions that went on between corp council and the nursing home administrator, as well as HR, about this. And then later on, as I think I shared in some timeline, I was brought in to have a discussion as well. And then that was later on. So I mean, your question about initiation, sort of that's my perspective on sort of the initiation piece. And then I think you've seen the timeline from there. So I'll pause, and I'll certainly let Sarah and anybody else who was involved talk about their involvement in those earlier parts of that discussion.
Okay, so to add on to what Josh said, as it outlines in the timeline that everybody received on 11/18, Corp Council requested to initiate a discussion with Taya Walk, the nursing home administrator at the time, about vaccines. Taya had talked with Corp Council briefly, and then her last day in her role was on the 3rd of December. So then I jumped into the role and continued on with the plans that were starting to come forward with this discussion. And really what it came down to was trying to really weigh out the risks and the benefits of having a mandated vaccine or not, and knowing the population that we had from a clinical aspect and the effects that the COVID disease itself has on the population that we care for, and weighing out the risks and benefits, whether we have a mandated vaccine versus not, and what actually happens with contracting COVID is how ill people get and the rate of mortality that it creates for our population. So yes, you can still contract and pass on COVID, but what the difference is you don't get sick from the COVID after a vaccine. So we really took into consideration the critical role that our staff play in maintaining the care level needs for our residents and having them available to be here to do so. And if they're out past the 10 days, which is what they have to be right now because they have such severe symptoms, that's where it really is taxing on our staffing levels and meeting our resident care needs. So keeping everybody as safe as possible, our staff included with our residents. Any other questions on that?
Yes, I'd like to follow up, please.
Sure.
You stated that you don't get sick after you've had the vaccine.
What's that?
You stated that you don't get sick after you had the vaccine.
Mm-hmm.
True?
From COVID. So if you were to contract, are you talking about symptoms after getting the vaccine related to getting the vaccine, or are you talking about contracting COVID and the symptoms from COVID?
I'm talking about, you had just stated that you don't get sick after the vaccine.
So if you were to contract COVID after you get the vaccine, what that vaccine does is it prevents you from having COVID symptoms.
So what symptoms would you have? Nothing?
What symptoms would you have? Is that the question?
Yeah.
Correct. It would keep you from having COVID symptoms.
So if I get the vaccine, I will not, if I were to be in contact with the COVID, I would not have any of the side effects from it.
From the COVID disease itself.
Yeah.
Mm-hmm.
Where'd you get that information?
That information comes from the CDC.
Okay. That's not something I've seen because I know that there's been quite a few people who've had the vaccine and then have contracted COVID after that.
So then the question would be, when did they contract the COVID? Was it in between the first and second dose? And then you're actually not built up an immunity until 14 days minimum after you receive the second dose. So there's a potential that you can still contract COVID after you get that first dose because you don't have the full effect of the full dose of the vaccine. And then you still have 2 weeks for your body to get that immunity built up. Very, very similar.
And they have this tested and proven on what?
Yep, there have been many, many tests. I've got some data here that I gathered for you guys.
Okay, so I'm going to move on then. So we had this drawn up. Did anybody sign the original flyer that went out to the employees? Or was it signed later by the medical director after the first shot was given?
The memo from December 23rd?
Yes.
That's a memo that goes out to staff that doesn't have a signature for a medical director.
So it just comes to an email or?
The memo gets labeled with every individual employee's information, so that way it's addressed to them and placed in their mailbox or hand delivered by supervisors.
All right, so we had a directive sent out, and I'm assuming it was sort of a policy that did not have a signature attached. So moving on, you have staff who are pregnant and or who had adverse reactions to the initial shot. Are they making it, is it going to be, do they have to have the second one? Are we taking into consideration that, you know, a second shot to someone who was allergic to the first shot could possibly, you know, kill them?
So there was another memo that went out to staff, similar to the one that went out on December 23rd. This memo was drafted and sent out on January 21st. And that alluded to, it was brought to our attention that some individuals were having reactions. And the language in that directed staff that if you've experienced a significant reaction to the first dose, that you feel it might be unsafe to receive the second dose, you would call your medical provider and they would help you decide whether it's safe for you or not. If you believe that your situation warrants an accommodation, then you would request the form for the disability accommodation.
Okay.
That would be reviewed by HR.
And that would include the pregnant ladies too, right?
It would not.
It would not?
No, so those are two different scenarios. I'm sorry, Sarah, for jumping in, but legally those are really distinct. They're not the same category of accommodation.
Okay.
So the basis for providing the accommodation to the individuals that have had the first shot only and had the severe reaction is that the data suggests that they enjoy significant immunity from that first shot, not complete immunity, but they are far less likely to contract COVID-19 after having the first series of shots only than they would be without any shot at all. For individuals who are pregnant and choose not to get the shot, they still are at the same risk of contracting COVID-19. And what the Pregnancy Discrimination Act of 1978 requires is that we provide the same or similar accommodation to individuals who are pregnant or who wish to become pregnant as we do for disability or for religious objection.
Yep.
And nursing home staff, in consultation with me and with HR, determined that we were unable to provide a reasonable accommodation for those two groups of people. And so we did not provide accommodation to individuals who are pregnant or who are seeking to become pregnant.
So what you're telling me then is they were laid off?
I guess I am unfamiliar with the precise circumstances of anyone, whether they were pregnant or seeking to become pregnant. I do know there were staff that chose not to get the vaccine and were laid off. I don't know if they were made that decision because they were pregnant or not. I don't know.
I don't either. I'm just asking.
Mary, hang on just 1 minute. Anybody who is in the meeting who's not speaking, please mute your microphones. We're getting an awful lot of feedback, so make sure you're muted.
Thanks, Tom. Okay, so like I said, I don't know if there's anybody pregnant or not out there. It was just something that was brought to my attention. I wanted to ask the question.
Yeah.
I'm not attacking anyone. I'm trying to find answers to all the emails, all the phone calls that I've been getting. And I'm thinking the rest of the board also has been getting those emails and the phone calls. So just clarification, for us of how this was drafted, put into effect, was there a meeting, training on it? Was there actual, where they could talk and have their input put in? Not necessarily they're going to say, hey, you don't have to get it, but you should talk to me. But, if you're training and education is a huge factor to get employees to follow guidelines. And I think we all know that from our own personal jobs that we've had. Have we ever had a mandate before like this? Josh, Rich?
Yeah, I mean, the short answer is yes. I think this circumstance is different in a lot of ways in which the mandates have traditionally kind of come down or been viewed. So we do ask for vaccine verification for both hepatitis and I forgot the other one off the top of my head before anyone can start their job. So that's the condition of employment in the same way that currently in its current iteration, the COVID vaccine is a condition of employment in the same way. We've also had practices surrounding the flu vaccine every year. Those have changed somewhat from year to year, I think especially in the recent past, given the change in nursing home administrator that's been at Rockhaven. But it has been a requirement, I think it's accurate to call it a requirement, that individuals receive the flu vaccine at Rockhaven.
And has everybody complied with it then for the flu vaccine? There's not been an issue with it?
I think others are probably better situated to answer that question than myself.
Sarah, do you know that answer?
So as Rich alluded to, the multiple turnover with the nursing home and administrator, the follow through of that had fluctuated. And we also had turnover in our infection control position as well. I know back in February, there was an email from an interim administrator that stated very clearly that the influenza vaccine is mandated and policies were being updated. And then also our old infection control nurse was involved in that as well.
Okay, thank you. That's a good to know thing. So this is really a hot subject. The COVID shots are. There's really not a lot of data testing on them. And all the people who have called me and emailed me are totally against mandating the shot. Personally, I'm kind of that stubborn person. If someone tells me I can't do something, I think we're all like that. We're going to find a way to do it, or we're going to find a way not to do it if they're telling us we have to. So, it's really a tough subject to mandate a vaccine that really has no true outcomes with it. What are the side effects going to be years down the line? Now they're saying that, the shots are not as effective as they thought they were. I don't know what the answer is. All I know is that I certainly don't want someone telling me that I have to get a shot that was just put out in haste, get something out there. Is it gonna work? You don't know. Everybody's different. You're the way that you metabolize things, and your immune systems. I have a hard time with this. I honestly think that it's not something that I want. I think that I want to be a part of, that we're going to mandate shots. This resolution is asking for, that not to happen. And we pass this resolution. I hope that there is a clause somewhere that's going to be put in here about reinstating the laid off employees, reinstating their health care, their benefits as if it was never gone, and back pay. I think this was not done the best way it could have been done and rolled out. And I think that's what the big kickback is of this. I think most of the people out there were, I don't want to say forced, intimidated, scared to get the vaccine to keep their jobs. And to me, that's kind of sad. When nobody else is mandating these shots, no other department is mandating these shots. And I understand that they are caring for elderly people. I totally understand that. Totally understand we want to protect them from catching it. How do you know they're not going to catch it from the milk cartons that come in? You don't know that. COVID lives for how long on surfaces? You're having delivery guys bring things in. Do they have the COVID shots? We don't know that. Are the cleaning crews mandated? I would assume they probably are, along with the food service people. So Josh, if you walk into that facility, do you have to have COVID shot? I'm serious. It's that's what you're doing by trying to require that. Totally against it. I don't think it was done correctly. I don't think that the employees were given this mandate in a positive manner, like we just talked about. It's how you present things. And, I worked with EMTs for years, and Ron can attest to it. They're the hardest people to convince to do something that they think you're making them do. So that's my opinion. All those questions, I think needed, the honest answers, and hopefully they were. I'm going to be in favor of this resolution. Thank you.
Hello?
Go ahead, Kathy.
Yes, couple of questions. I want to know exactly who was involved in making this decision. I want to know if public health signed on board to this. I am wondering if you looked at the fact that no other county in Wisconsin had approved mandating the shot. That's some starter questions.
I think Josh already went through the timeline of how it was developed.
Was public health involved in this?
So public health was not involved in this discussion.
Okay. I think putting this mandate in place was the wrong approach to getting cooperation. I will tell you personally, I plan to get the shot. However, I'm not mandated to do that. And if I do have a bad reaction, I won't take the second. And I think it's really important that you allow people to make some choices that they think are in the best interest of their body and their family and other things. The staff are not indentured servants. They are staff and they have rights too. When we respect the right of residents to say no, because maybe they know something and you're willing to protect that right, I think our staff needs the same consideration. There was no other department, and I understand there's more contact there, but when you push that on somebody, they get their back up. And there's so much misinformation going on right now that I think it just boomeranged in an opposite direction. I will be supporting this resolution because I think it's needed. I think it's needed to calm things down. I think it's needed to get staff back there working. And I fully support testing and wearing masks and washing your hands and doing all those things because they have proven to be effective. The medicine may be very helpful. We haven't had long-term testing to see what other effects could be byproducts of it. Maybe there'll be none. I hope there won't. But we don't know that for a fact. Because a lot of things, it has taken 5-10 years sometimes to find out things. And I think we need to respect the people we've asked to work for us. Thank you.
Go ahead, Ron.
To me, this shouldn't even be an issue. There should be 100% compliance without this mandate. We are working with the most vulnerable population we have. When this first came out, I heard about it. I saw some of the emails. I went and I got on social media. We have a lot of irresponsible people out there. They're bringing it in. COVID's only getting in there one way. Simple. It's not coming out of milk cartons. It's not coming in through. It's coming in through the employees. And if we don't stop that, we're never going to have it. For our interim administrator to make this decision was a tough decision. I'm sure of it, but it's her responsibility to keep everybody safe in there. We have a responsibility to our residents. Those are our primary responsibilities. Secondary one is our employees. And if we can't keep them safe and allow them, it's going on almost a year now that they haven't seen their family because of this. And we have a small minority that don't do this because they were mandated. I mean, there's a person out there that I got an email from, they're not doing it because they were mandated. They were going to do it before. You got to be kidding me. I've gotten a few phone calls on this, not a lot, but I will say 90% of them have false information on why they don't think it's right. It was created from aborted babies. It's unconstitutional. It's just the flu. Don't worry about it. It's not approved by the FDA, and that's false information. And Kathy brought it up. Her point is there's a lot of misinformation out there. There is. That's why people aren't taking it. The government, Dr. Fauci, is not going to let us take something that's bad for us. I understand we don't know what the long-term effects of the vaccine is. I get that. But we do know what the long-term effects are of COVID if you get that. There is going to be respiratory problems. There's going to be other issues, and especially in our elder population that's out there. What happens if these employees don't get a shot? They become get COVID, they become ill. Now they want to say it's a workman's comp claim. They want the county to pay for everything. What happens to our health insurance if someone's on a ventilator for how many weeks, months? Does that go up? We're not looking at the big picture here. I'm going to vote against this. I think it's the right thing. I think they made reasonable accommodations to people. The county has done a great job of providing out there. Everybody got a $500 bonus, for working during COVID. People working out there that work in the COVID wing, they get an extra $5 an hour. At the first of the year, they extended their leave if they get quarantined again. They didn't have to do that. They could have said, you're on your own. They didn't. They chose to do the right thing. They work for a place that's got a great pension. They work for a place that's got great health insurance. If it's so bad, go work somewhere else. Go work for every long-term care facility is hiring right now. If you don't want to get COVID, that's fine. We'll get people that do. I just, for the life of me, I cannot imagine why you don't want the vaccine. It's not always about you. It's about the other people. I stepped up. I don't go out and see patients in the field anymore. But the last Rock County EMS committee meeting I was at, they said about 60% of the people we transport now have COVID. So it's coming back into the station. I don't want to get it. I don't want to take it home to my family. I don't want to give it to someone else. And if we want to get that facility open so people can come back in and see their families, this is what needs to get done. Bottom line. Otherwise, it's going to delay it, and who knows how long this goes on. So I bet some of the voicemails I got are disturbing. I'm sorry. It's not criminal. I'm not unchristian because I believe of this. I'm not going to have Sarah or Josh fired because you don't like a decision they make. Decisions are tough. They made a decision, and I'm support them on this hard decision that they made. For someone to say that I'm unchristian because of this and their bully tactics, and they're going to get people to run against me next time, go right ahead. I don't need the headaches. I've done everything I can to support the workers out there to keep Rockhaven open. And if one decision I make you don't like, and another 99 I like, and you're going to boot me out, so be it. Get someone to run against me. Let me know who it is, and if I think they're a great candidate, I won't even run against them. Because I don't need this. I can see in Sarah's face right there, she doesn't need this. Sarah stepped up when we needed a leader out there and took over out there, and she made a very tough decision, being an interim administrator. And I want to thank you, and I hope this doesn't give you bad taste in your mouth and you want to leave. I do appreciate what you're doing out there, and you are looking out for the residents. And if other people don't have that same viewpoint, go work somewhere else, because I don't think this should be working for the county. So thank you, Sarah and Josh, for what you guys are doing.
I'm going to support the resolution. I'm going to get the COVID shot. And that's a decision that I can make, and that somebody else isn't going to tell me that I have to have it done. So I will be supporting the resolution. Is there any more discussion? Seeing none, all those in favor signify by the sign of aye.
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 Aye. Opposed?
Aye.
The motion passes 3 in favor, 1 opposed, and 1 absent. Motion to adjourn.
Bomkamp moves.
Beaver
Schulz seconds.
All those in favor signify by the sign of aye.
Aye.
Opposed? The ayes have it, so order.
Thank you, everyone.